Namaskaram to one and all, respected sir and Vivi sir and all other faculties and my dear PG scholars of Amrita Institute. And in fact, I am very much blessed for this opportunity. Uh, and I'm very sorry once again. On a formal note, I apologize for not taking this class 2 months back. And um, they asked me to take a class on Rasaushadhis with special reference to Vata and all. So I suggested some modifications and told that okay, let it be neurological disorders apart from introducing Rasaushadhis plainly. So I thought of management of some neurological disorders because this is a 1 hour class, so I have to crowd my slides and all to this presentation. Anyway, we will quickly move on to the presentation. Okay, so these are the contents: introduction, case presentation, the concept of Vayu, and I know that these are all basic lessons. In quiz we say it is fundas or fundamentals. Anyway, we shall just have a brush up on the fundas and we will go to the main slides. Okay, so what is Vata? Whether it is a merely a dosha or how can you define Vata? I think let it be an interactive session because not only myself, you can also contribute to this presentation, and we can improve Rasa Shastra much better in a broader sense. Okay, so Vata, this is not merely a dosha. This has and people argue, especially the modern scientists argue that Vata is something which is cannot be seen. Some say it as ether, and so many definitions are there. But I think it is better to design Vata. We can broadly we can say these are a set of gunas which together contribute as a Vata, or these set of gunas are called Vata. Anyway, I quickly move on to a case. Okay, so I need your help for this diagnosis. A 60 years old female, she's a housemaid, came to the clinic, complained of severe knee joint pain and leg pain, both legs, and swelling of the joint stiffness. She is difficult to sit in a squatting position for prolonged time and has insomnia due to this pain with 3 months of duration. And on examination, tenderness was there, pitting edema was present, and dalgic gait was there, and also deformity. There was no limping. Anyway, and she had no history of diabetes, hypertension, dyslipidemia, rheumatoid arthritis, or rheumatic factor. Irregular food habits have been seen, and the symptoms started about 5 years back with the knee joint pain, and she took some treatment and got symptomatic relief. Her appetite is normal, bowel are regular, and these are all the sleep is disturbed due to pain. And on examination, we found that pre-patellar bursitis, swelling, effusion, temperature was increased, and the crepitus was present. What will be your diagnosis? So just tell me. Okay. Okay, most of you are telling that it is a Sandhigadavada case. Okay, so but this was diagnosed as Majjagadavada. You may be thinking why. Majjasu asti saushiryam asopnam tivra vedana. Here, in most of the cases, we have a misdiagnosis because you just observe um, our hospitals. Most of the modern hospitals are giving their advertisement that 6,000 knee replacement surgeries have been done in the last 1 year. Even one of my cousin, he holds a record. He's working in Tiruvalla hospital, and last month he had a celebration that completed 1,000 knee replacement surgeries. He's an orthopedic surgeon. So most of the conditions having knee joint pain, which we are diagnosing it as Sandhigatavadam, they are going for replacement. I think at least 600 or 10% of the cases might have sought Ayurveda for a better remedy. But what happened to that problem? Is that the same Vada? Then how it transformed to Manjagata Vada? This is the question. So I think this we all people, Ayurvedic physicians, go for a conclusion that it is a Sandhigata Vada. See here, this problem has been there for about 5 years, and she had taken some treatment also, some kashayam and all, Vyasana Saptakam, Vyasnadi Kashayam, Maharasnadi Kashayam, like that. So most of the physicians have given them kashaya, but none of them gave her any thailam or ghritam for internal application. So this is what the Rukshada will aggravate, and that lead to Vada disorders. Okay, so this was a case of Majjagata Vada. So here that you have to observe the symptoms, and the sleep was disturbed. The sleep was disturbed not due to the her son was in abroad. It was due to typically she told that the sleep was disturbed due to pain. So the pain is the symptom or the reason behind sleep disturbance. So Manjasu Astisaushidhyam. Here, if you take an X-ray, we will see osteoporosis. So Astisaushidhyam, Aswapnam, and Tivra Vedana. So this is Vada. You all know this definition and all. It is responsible for Ulsaham and anything. And Vayu, Tantra, Yantra, Thera, Pranodana. You have heard all these things. So describing Vada, this is very complicated. It's just like another human genome project. Uh, so just a quotation from Max Planck, because he was a propounder of quantum theory, and he found that all behind this consciousness. So here, the Panchabhuta theory, these are the places where our theories and modern science get collaborated. So you know the Panchabhuta theory, and all are Parasamsarga, that becomes different things and all, and also the Tridosha. You all know the positions and all. So these are the properties of Vayu, and coming to the property, you know, Luksha, Legu, Shita, Karasushma, Chala, Anita. So Vata functions. We have different types of Vata, Dasha Prana classification, Pancha Prana classification. And in that, Prana is something which is very important. That has got the supreme control over all the Vatas. But you cannot control Prana as such. We have Prana related Vyadis and all. Udana related Vyadi, Vyana Vyadi. But only thing you can get some sort of control is Apana Vayu. Because first of all, let me clear that any sort of you have all the properties, that is Ruksha, Laghu, Shida, Ghara, Sushma, Chala. Everything is there. But only thing which is apart from all these things, that is, I want to substantiate that Prana is Snigdha. All other Vayu are Ruksha in nature. Abana, let it be Abana, Samana, Vyana, everything. Prana is Snigdha in nature. And if there is a Rukshada for Prana, that means degeneration has started. Okay. So any sort of degeneration to Prana, that means, or any sort of Rukshada to Prana, that will lead to degeneration. That may be tuberculosis, that may be whatever, death will happen. So you cannot control Prana as such. So how will you approach Prana? The only thing is that, just imagine a ministry. So ministry, there are set of cabinet ministers and all. So you don't know ministers in person. What will you do? You will somehow contact a local party leader. Then he will have a connection with the private secretary or personal staff of the minister. Then they will refer you to minister. Like that, that is a sort of linking different persons and all. Like that, you can somehow connect Apana Vayu. You have some sort of control. Yogi people and all will have definitely, they have a control and all. I am not in an argument with them. But apana vayu you can somehow control. That's why apana vaigunyam occurs due to vada vriddhi, and also the treatment is considered as vasti for vata. So you can control apana vayu, and then you can control prana. That is the root. Okay. And you all know the functions of vayu and all. Regulate all senses, sensory functions of gut, reflexes, expulsion of waste, everything. And and it also influence Agni, that is Vishamagni or Krura Koshta, that happens due to Vata. And what are the rasas influencing Vata? Lavana is made of Jala and Tejas, Amla is of Prithvi and Tejas, and Madura is of Prithvi and Jala. So, Datradeyo, Maridam Kinandi, you have heard about all these things. So, Vata is a Prakriti. What is Vata? Seeds of Vata, Pakva Shekadi Saktinis, Rodasi, Sparshanendriyam, Sthanam Vadasya, Tatrapi Pakvadanam Visheshata. So, Pakvadhanam is the Vishesha Sthanam. That's why we all give treatment to Pakvashya. And this is also very important, I consider, because this is from Ashtangrade Nidanasthana, the first sloka, Tiktoshna Kashaya Alparuksha Pramida Bhojane. So in our country, we are not taking as Tikta foods as such. And Kashaya, we are not taking Kashaya foods as such. Okay, you may be drinking Kashaya and all. Otherwise, Kashaya Rasa drugs are very rare. And Alpa Bhodana and Ruksha Bhodana are very common in our day-to-day life. And also Pramida Bhodana. Pramida Bhodana, some acharyas have an opinion that Pramida Bhodana, it is not of proper quantity and all. Actually, Pramida Bhodana is something which is on untimely food. That is Midam Matra Allah in the Paraya. How can we define that? So if you take the food, if you are taking breakfast as brunch, then that is Pramida Bhojan. So, okay. So Dharana Udirana, these are all common right now. Nisha, Jagara, Ticha Bhashanai, these are all causes of vitiation of the Vayu. So in general, we can tell that Pramidashanam, Alpabhojanam, Vegadharanam leads to Vada disorders. And also the classical Lakshana Dhadu Kshayam and Srodhorodham causes Vayu Visheshan, and that leads to diseases. So in Vada Roga, there are no Purva Roga. And okay, let us classify. This is a reference from Ashtanga Sangraha. So in Doshopakramaniya, there is a typical dhadu and the lakshana, that is visheshan of vayu in that particular dhadu will cause these all lakshanas. For example, vayu is sitting on tuk or rasa dhadu of tuk, that will cause Spudana, Rukshada, etc. If it is in Rekta, you will have the symptoms like Tibra Ruja, Sobanandam, Ragam, like that. And if it is in Asti, Sakti Santi Shula, Tibram Pelakshin. And if it is in Majja, Asti Sopshitiam, Soplan Tibra. And another one which is not included in Ashtanga Sangreha is the Sandhivada, Vada Guna Trispasa Shobam, Prasarana Punjanam, Pravartimcha Vedana. You all are familiar with that sloka. Like that, Acharya have also classified Pitta in Tukka, Pitta in Rekta, then Pitta in Mamsa, like that. And also Kapha in Tukka, Shaitya like that. Kapha in Rekta, that is Pandu. That's why we can eliminate Pandu by simply giving some kapha vitiating drugs. If you are giving Trigadu Churna for 1 month with honey, that Pandu will get rid of. That's a aim of this treatment or this classification. So it's very easy. You can also, as a blooming doctors, we can do this classification. You may put it as a Excel file, so you will be able to refer all these symptoms. So you can see many symptoms here. These are all the symptoms, these 54 or 56 symptoms are presented by the patients in our OPD. What is the symptom? Okay, so is this Shikra Mutra Sarga? So you can refer that, okay, that is Vayu in Shukla. that is causing that problem. Like that, we can classify it very easily. And the Ashiti Vada Vigara. So, what is the Vishesha Chikilsa, Vadasyo Putrama Sneha Sweta Murduni, Sri Toshna Madhuranga Levanine, And all the Aushadha Kalas that is coming to our topic. Aushadha Kalas are mentioned by Vata. These are all based on Vada. Whether it is Abana, Adho Bhakta, Prag Bhakta, Madhya Bhakta, Andhara Bhakta, or anything that is all based on Vayu. Okay. So coming to the chronic diseases. So chronic diseases, what is the problem is that major contribution right now in the 19th century, most of the disease or death, cause of death was due to famine or communicable diseases and all. Right now, 80% or 71% of the death as per WHO, it is NCD, okay, non-communicable diseases. And major NCDs contribute to 80% of the premature NCD death. So you can see the global burden, that is $47 trillion in 2030. That is people on this non-communicable disease. So we can easily get rid of all these diseases with the Ayurveda. So we have to explore the possibilities of Ayurveda. So these are some of the chronic diseases: cardiovascular diseases, cancer, diabetes, chronic respiratory diseases, arthritis, obesity. So in this spectrum, I am picking only some neurological disorders. Okay. So CVA, you are very familiar, cerebrovascular accident or Pakshagata in Ayurveda. Right now, fresh cases are very less. I don't know whether you have seen anyone paralyzing in front of you. But I have seen some people, some fresh cases have been treated by me because on a few days back, one person, he got paralyzed in front of me. He was telling that some discomfort, I am coming to see you. And I think he was a BP patient. He was taking medicines for BP and all. So he came to the clinic and told me I need to see you immediately. So, okay, please come. At that moment, he was telling that he was having the symptoms of a cerebrovascular accident. He was a chain smoker and all. But somehow we were able to, I will discuss the case. Okay. Manage it immediately. You can easily manage it with the Rasaushadhis. So it's one among Vata Vyadhi, Mahavyadhi as per Ayurveda and all. So obstruction of the cerebral blood vessels, it may be ischemic or lack of glucose or metabolism and weakness of nerve cells at all. So age is a factor, hypertension, atherosclerosis, injury, nutrition imbalance, everything may be a factor. Even deficiency of vitamin B is causing this CVA right now. And symptoms, weakness of arms and legs, face, numbness, mostly one side of the body, confusion, dysphagia, difficulty in eyesight, and unconsciousness or severe headache or dizziness. So most prevalent one is ischemic stroke, and hemorrhage is very less compared to ischemic diseases, ischemic strokes. So MRI, you know the basics of MRI and all. Here we can see two MRI. This is a T1. This is an example for hemorrhagic stroke, and this is a T1 weighted image. You can see that fat appears bright in the T1 weighted image, and the water appears dark. And you can see a hematoma here. This is, and another one. This is a T2 weighted image. Here, water or liquid fluid appears brighter. You can see the hematoma. Okay. So you all know that different types of reasons of stroke, the embolism or the blood clot in the artery causes the stroke. And what is the protocol? So we have, we all usually compare it with the Pakshakadam, Snehanam, Sayada Samyuktam, Pakshakadi, Virejana, right? Snehanam, Sayadana, Virejanam are the treatment for this Pakshakada also. So we can also incorporate Murdha Tailam, Vasti, Dhadu Vartaka, Hara Vihara, and Rasayana along with this thing. So this is the protocol for uh, that Pakshakada Chikitsa. So in a broader sense, we can classify it as Amapachanam, Srodoshodhanam, and Dhatu Poshan. Here in hemorrhagic stroke, we can, first of all, you have to give Stambhana Chikitsa, Stambhanam, then Vata Pitta Chikitsa, and Dhatu Poshan. That is a line of treatment which is efficiently managed in most of the hospitals and also in our hospital. So additionally, we may have to give rehabilitation therapy, speech therapy, or physiotherapy, everything. So management in Ayurveda. Amavadari Rasa has a key role in managing these conditions. So it is a reference from Bhaishiji Ratnavali, Amavadadhikara. So all Vadas will have an Ama Avastha initially. So Parada, Shuddha Gandhaka, Loha, Tamra, Tukta, and Tangana Basma, and Eranda, as you know. So the main indication is Vada Rektam and Vada Shobham and also Amavada. So you can give it in a higher dose, that is 1 karsham. And Anupana may be any Kashayam, Eranda or Ushnodagam. Here, usually Apatyam are Shira and Mudga. So this will immediately relieve that tissue inflammation and relieve muscular pain and also the pain due to soft tissue injuries and all. So we can effectively manage the condition. And this is also in another diseases, we can reduce the morning stiffness, low backache, and also given in larger doses. Because most people will tell that, okay, Parata Gandhaka, doctor, can we give it in higher dose and all? But this is very effective, and you are not giving for a lifetime and all. So initially, after the AMA is relieved, you can withdraw the medicine also. And Suvarna Muktadi Gulika. That was I was telling that that patient, in that patient, she was having that symptoms of stroke, that is numbness of hand, left side of the body, and he didn't show any convulsions and all, but he has one side was getting paralyzed. And that time, I just gave him Maharasadi Kashayam along with the Suvarna Muktadi Gulika and also Sahajaradi Savium, that is Medupakam. That was immediately administered. And after 5 or 10 minutes, and we were calling, waiting for an ambulance. But after 5 to 10 minutes, he was okay. And he told that, okay, I don't need to go to the hospital. But I referred him to the nearest hospital because it's a golden hour. We don't know what will happening and all. But I referred the patient, but he didn't, this fellow didn't go to the hospital. But he was a chain smoker. And I told him that you have to quit smoking, otherwise this may happen within 6 months. But the same stroke came after 6 months. The same thing. He was he was at home at that time. So they took him to the hospital, and they told that it is a stroke, and they gave some stroke that blood thinners and all. Then he came to Ayurvedic hospital for the treatment. So rest of the treatments were done at our hospital, and he's okay right now, and he has quit smoking. And the management was like that: Pitta, Dosha, uh, Amavajana, Balya, and Rasayana therapy. So Swarna Muktadi Gulika is a very effective yoga. It is found in Yoga Grandam, Kotakal Ayurveda Yoga Grandam, they are publishing. Uh, and it is a very interesting formulation. It has got Suvarna, Mukta, Rajata, Pravala, Rudraksha, Vaja, Kushta, Kushmanda, and Kunkuma. So it will relieve, has got a very good neuroprotective action, and it is effective in convulsions and tremors. Okay. And coming to another, that is the case report. So see, you can see that acute ischemic stroke, immediately given Maharasari Kashaya, Suvarnamtadi, Sahajradi Milpadam, and Rasna Jampiram Tala. That was the first treatment given in that case. Then Dhanyamla Dhara, Uddvartanam, Patra Bodala Svetam, Pichil, Virejanam, Ashtavarganga Shayam was given, Shadharna Churnam, and Eganga Virasam was given. On a later stage, Snehavanam with the Sahajradi Thailam, Svedanam, Virejanam, Murda Thailam, Vasti, Snehavasti, Kashayavasti, Kshira Dhumam, and Siddhamagradujam along with the Brahmarasayana was given. So this was the management, and right now he is very okay. He's able to perform all the activities and all. He's very healthy right now. So here in hemorrhagic stroke, the line of treatment is Vata, Pitta, Shamana, Chisa, Rukshanam and Svedanam in mild form only. That you have to be very careful in mild form only, because you cannot give much Svedanam that may cause complications at all. And Mudra you can apply, Kshirapala like that. Then Guluchadi Kashayam, Drakshadi Kashayam, and Vidaryadi Kashayam is the first line of management usually given in hemorrhagic strokes here. Then Abhyangam with the Pindatailam or Shirapala or Pelatailam. Then Snehavana with the Kalyanagam or Vidaryadi Kritam. We used to give some Rasasindura or anything added with the this Kalyanaga and all. Right now, we have done some experiments with the Rasasindura by incorporating Rasasindura in Vasti. So if you are giving a Matravasti or Sneha Kashayavasti, we used to put some Rasasindura in it along with the Vasti, and that is also showing good results. So that was just an experiment, and we have not published it, but that also is we are getting good results with that in such conditions. Okay. Then Shashtika Pindasvedam, Jambira Pindasvedam, Pichil or Shiravasti we can give. So most of the cases in that patient also 25 to 40% stroke survivors face aphasia. But in that patient, this was completely relieved. This is caused by brain damage in the left side of the brain. And there are 8 types of aphasia. So these are all based on 3 distinctive features, that is fluency, comprehension, and repetition. And this may be aphasia, maybe of fluent aphasia or non-fluent aphasia or progressive aphasia. These are the types, and I think you just I think you should understand what are the differences between that. The Broca's aphasia, that is known as the non-fluent aphasia, there may be halting and fragmented speech. That is, patient cannot name that thing, but instead he also find difficulty in sentence formation and all. That is Broca's aphasia. And coming to Wernicke's aphasia, there is impaired auditory comprehension also. So here the fluent, and it is very fluent. The patient will be speaking fluently and grammatically correct, but they will be telling some meaningless words and all. So the content may be meaningless. Feel that okay, he's speaking fluently, but we are not able to. That is the patient is telling something, but that is not relevant to the subject. That is the Wernicke's aphasia. In global aphasia, that is I think most severe form of aphasia. The patient will struggle heavily because he will not be able to comprehend. He will not be able to reproduce the speech, reaction, and also reading, writing. Everything will be impaired. So that is due to the widespread damage in Broca's and Wernicke's area. You know that Broca's speech area and all. Broca's speech area 43 you have studied and all, and Wernicke's area. So this is the complete damage to Broca's and Wernicke's area. That is why the global aphasia, that is most severe. And anomic aphasia, that is given down. That is also fluent aphasia. The patient will be fluent, inability to supply or correct word for things, and there will be vague speech and also pauses somewhere. That is, he is not able to speak fluently. Okay. fluency will be there, but he will not be able to get the correct word. And just like politicians who wish to answer the questions, they are not interested. They will just jargons and all like that. So many large number of words will. That is the problem with anomic aphasia. Then conduction aphasia is there. That is also fluent, but they will repeat the words. Okay, that is a repetition of the words will be there in conduction aphasia. And in transcortical motor aphasia, there is sensory aphasia and motor aphasia. Sensory aphasia, it is a there will be a fluent speech and all, but a poor auditory comprehension and naming, etc., will be present in transcortical sensory aphasia. In transcortical motor aphasia, that will be a non-fluent speech. So the damage, there will be impairment in that area around the Broca's area. So patient will not be able to fluently express his ideas at all. Then coming to the PPA or primary progressive aphasia. That is a very rare neurodegenerative condition. So these are the classification of aphasia after the complication of stroke. So you have to manage it with our medicines and also speech therapy if necessary. This is the common line of treatment followed in most of the hospitals, and I am just telling our line of treatment. That is aphasia or dysphasia, snehagandusham, nasyam, or swarna basmam we can give. Brihatvada Chindamani Rasam is having very good action. We are getting good results on Brihatvada Chindamani Rasam. Only thing is it is very costly, 160 rupees per tablet. Otherwise, it is very effective. Then Jihwa Lepanam, Vajadi Churna with honey and ghee we are giving. Saraswata Kritam or Varnadi Kshira Kritam along with the Rasasinduram we are administering. In cases which need speech therapy or music therapy, we are giving that also. So I think Swarnabasmam is the key ingredient to manage this condition. Murdam Swarnam Madurancha Krishyam Krudyam Cha Netriam. You have studied the sloka, Paramam Cha Medyam like that. Rasayanam Pumsavana Upayogi. Vishabham Kandikaram Cha Shastam. There is a definition given by Dasatarangini for Swarnabasma. So the properties of Swarnabasma. So it is very effective in the management of aphasia. So this is the classification I have already told you. Then Medhi Rasayanas play a vital role. Vajarudrakshadi Churnam, and you can give it as a legion also. And Vakpravarti Churnam, that is a formulation we have formulated in Kerala Ayurveda Samajam with the help of Ashtavidyas and all. So that is Shundi Pipali Vaja Haridra, Daru Haridra Kushta with the Grida. This is a formulation. That is not all these are Vadahara drugs, not any media drug and all, but this is improving the Vak Pravarti. So this is an Anubhuta Yoga which is used to manage these conditions. Then obviously Manasamitra Vadagam. Manasamitra Vadagam you can give. That is also containing Swarna Rajata Pravala Tapya etc. So Smriti Anidra Pasmara. And I have found that most of the people advise Manasamitra only in sleeplessness. No, this can be given in many conditions like a stroke or stroke management, and it is suitable, very much suitable with the Brahmi Gridam or Kalyana Gridam or any other suitable Anubhana. And I have seen good results in managing the convulsions and all. Because in Abasmara and all these after administering Manasamitra Vadaga, we have got good results. I found one person came to me, my clinic and hospital, and told that, sir, I am getting Abasmara on every Friday. What is the cause? I don't know what is the cause, but I thought some sleep disturbances and all. But I don't know whether it is a psychological or not. Every Friday he will suffer a conversion. So I started Manasamitra Vadagam. His sleep was getting better. And he told that, okay, after 1 month, he told that, okay, in the last Fridays, there were no any signs of convulsion at all. But after 1 month, again, seizure came. So we were able to reduce the interval. So we gave, he was very poor patient. We cannot give some internal therapy or IP admission and all. It was not possible for him. Very poor patient. But anyway, the frequency of this convulsions was reduced. And after 6 months, he told that, okay, in the past 6 months, there were no episodes of avasmara. So in Avasmara also we can give Manasanitra water. Then Hridayarnavarasa. Hridayarnavarasa is a very popular drug. Paradagandhaga Tamarabhasma we are giving. And it is indicated in Kabaja Hridroga, Chanamatra, you know all these things. But it will improve heart function and regulate BP. That is given as a protective drug, especially in as a discharge medicine. We are giving Hridayarnavarasa to that patients. So they will be taking along with their own medicines, but still we have got good results. And Prabhagaravadi also. Prabhagaravadi, the reference is by Shri Ratnavali Hridroga Digara. It is also containing Makshiga, Loha, Praga, Duga, Shiri Shilajadu, and Bhavana in Arjuna Kashaya. The indication is all Sarva Hridroga. We can give it as 2 Gunja and all. So it will definitely strengthen the cardiac muscles and regulates heartbeat and also palpitations. And it improves blood flow and regulate BP. Not only in heart diseases, but all sorts of Rakta Vigaras, and also whether we need to manage in Vata Rakta also, we used to give this Prabhagaravadi to improve the function. So in Vata Rakta patient, if you just do the investigations, if you go for CRP or high sensitive CRP, if you are doing high sensitive CRP, it may be raised in some patients. So there may be a chance of heart problems to that patients. So in such cases, you have to definitely give Prabhagaravadi. So it is having Makshiyavasma and all. So it has got very good results. After the 1 month of administration, we have found that this high sensitive CRP levels have come down. That is, the inflammation has reduced, and also the heart function was improved. Okay. So let's move on to the next case, that is cerebellar atrophy. This is another case. I think this was published by me. A 50-year-old gentleman, he was a tea shop owner from Coimbatore. He had a drunkard gait and was not able to walk without support. So he came on the shoulders of, putting the hands on 2 shoulders of 2 people. He had a slurred speech. The speech was not clear, and the hands were shivering. I thought, first of all, he was a drunkard. He was just like looking like that. But later on, he told that he has not taken a single drop of alcohol in his entire life. So he was not able to run the shop because he was shivering and all. And people told that he's a drunkard, so don't go to his shop. So he had to close the shop. And that means he had no job. And he went to Ganga Hospital at Coimbatore for a consultation. And they took some MRI and all, and it was diagnosed as cerebellar atrophy. But I also found that it was a case of cerebellar atrophy. Later, he showed me the MRI reports and all. So I just documented that case, and this was the using the cerebellar atrophy grading scale. So there were no pill rolling movements. So we confirmed that there is no resting tremors and all. So it was not a basal ganglia dysfunction or a Parkinson disease. So the only option is only cerebellar dysfunction or cerebellar atrophy. So he had a cerebellar gait and all. So it can be divided into paraneoplastic cerebellar degeneration, which sometimes precedes the diagnosis of cancer and all, or it may be an alcoholic nutritional cerebellar degeneration caused by vitamin B1. So this was a purely a typical cerebellar lesion. So this can be correlated with the Kambavada. Kambavada we have Kevalavada Chikitsa. So that line of treatment was followed, and he was given Indugandham Kashayam, 90 ml twice daily for 1 week. Then Shadharnam Churnam. On the seventh day, it was shifted to, after getting the symptoms relieved and not symptoms, that Amavastha was relieved, we gave him Grida, because we have to give Grida. Ksheerabala was given for Nasya and also for external application over the scalp. And the Anandara Thailam was given for external application all over the body. And he was advised to come after 2 weeks. On the 21st day, he came back. And at that time, there was no difference in symptoms, because the slurred speech was there. He was not able to walk without support, and all those symptoms were present as such. Okay. So I thought, what is the remedy? And he was a very poor patient, and he was not willing to get admitted and all for Dhara or something. So only option was to give something like Swarnavasma, but it was very costly. He cannot afford that thing. So we thought of giving him Apragavasma along with Yanaga Drida, 10 ml at night. So Ksheerabala Thailam was given as an external column. And in the olden days, there was a practice to give these things for one mandala kala. One mandala kala is 41 days. So I decided to give him for one mandala, 41 days, but that was 50 packets. So I gave him 50 packets, and I told him to come after 50 days. The patient was very cooperative, and he came on the 50th day, oh sorry, 75th day. And I found very good relief, because this person was walking without support, and the slurring of speech was somehow cleared, and he was able to communicate properly. He was walking just like our human, just like other human beings, but not having the speed like our speed, and was not there. But still, he was able to walk, and he was able to communicate. So on the 71st day, I gave him Dhanadayanadi Kashaya, because some infarcts were there in the MRI report. Ksheerabala Thailam with 101 times or 101 Avrati was given along with the Kashayam. It was shifted to Indugandham Gridam and also Dhanvantaram Thailam. Ashwagandha Rasayanam was given at bedtime. So this was the score before treatment and after treatment. So the total score was 29 initially, and after the treatment, it came down to 4. So this was the video taken on 71st day. So this person was able to walk without support. Even this movement was not possible on the first day. Okay. He was not able to sit also. The tremor, everything was reduced. And I'm sorry, I don't have the video on the 101st day. That is after 3 months. But that was completely relieved, and he came by walking to the clinic, and I told him to walk throughout that veranda, hospital veranda, that 100-meter veranda, and he was comfortably walking without support. And he told me at the time of leaving that, doctor, I am going to open my tea shop, because right now I am free from symptoms. I think that was the result of that treatment. So Apragavasma has got a very good role in managing this brain disorder. Prajnabodhi Prashamati Rujam, right? So that is the guna of Apragavasma. And just for curiosity, I calculated all those treatment expenses, and it was found that only 1,100 rupees for my curiosity. So this is a very low cost or a very effective management with this Apragavasma. So this was recorded, and this was also published. And after getting this published, some people called me from Canada, US, Australia, and all. That is, doctor, I have read your article on these things. I have the same symptoms and all. So shall I come for consultation and all? Some online consultations were there. So anyway, the publication cost was met by that. Okay, so that's all about abragapasma. So we can give 1 to 3 reti in different anupanas. We can use for the different conditions and all. So it is uh, Kasa, Swasa, Ojakshaya. We are using beetle juice, butter, ghee, or honey. For Pandu hemorrhagic conditions, we are using honey and all. For nerve tonic, we are using it along with the butter or ghee. So in this condition, I gave it with the ghee at bedtime. So it is a relieves Mastulunga also if kidney diseases and all. So coming to next is the Parkinson's disease. Parkinson's disease is a chronic progressive disease of nervous system characterized by rigidity, bradykinesia, that is a slow walking and all, tremor, postural instability and all. So many causes are there. These are all the causes and affect the substantia nigra in the basal ganglia, leading to the destruction of dopamine producing neurons and all. So here also we can use the same principles, that is the Kampa Vata Chikitsa. But here this is more Vata Kapha dominant compared to the other problem. Because that was a little bit Pitta dominant. Here it is more Vata Kaphahara. Vata Kaphahara Chikitsa should be administered, and also Avarana should be considered in this condition. So you can give that Sneha, Swedana, Shodhana, Vamana for removing the rigidity and all. Urdhva Vasti, Rajayagna Vasti. I already told you that incorporating Rasatherapias in Vasti and all. So these are all we are giving in our hospital: Maharasadi Kashayam or Bhadradarvadi Kashayam, Varuni Thailam, Saradradi Thailam, Mahanarana Thailam, Shira Belanasim, Abhayarishnam, Belarishtam, Lasunakshiram. Lasunakshiram is very effective in such conditions, and also Abragavasmam, Rasasinduram, etc. Brihatvadasindamani, etc. So it's another drug, Vada Vidhamsarasa. Vada Vidhamsarasa, you may have studied this thing in Yogaratna. That is having Parada Gandhaga, Naga, Loha, Tamra, Abragavasma and all. So in Vada Roga, Shula, Grakani, and Sudhiga Roga, we can give this Vada Vidhamsarasa. I usually give it with a kashayam or warm water, right? Plain warm water. And it is very effective, especially it acts as an antispasmodic drug. In osteoarthritis or sciatica conditions, you can manage the pain, because pain management is a very important thing. So in SLE also we have given, and also in vascular necrosis. This is most people. I just had a survey during my class last 1 year back. So many people, physicians were there. So I told them that whether are you using this Vadoidam Sarasa? So many people told that, oh no, we are afraid. But I told them, okay, have you prescribed Stifine or some other drugs which are commonly available in the market? Okay, and I told you what is the dose. They told that 2 tablets twice daily. Okay, so I showed the contents, read out the contents of this that tablets often. So they told them, okay, oh, we didn't know that these contain this much drugs and all. Anyway, people are afraid of prescribing, but they are oftenly prescribing many other patent drugs which have some irrational combination of Vadadam Sarasa, I mean, Brihatvadajindamani and that Vasanta Kusumagara, like that, or Eganga Virasa, like that. So many drugs irrationally combined. Anyway, so this has to be very much careful. It contains lead as an ingredient. And coming next is the diabetes. Diabetes, you know, there are much influence of stress leading to diabetes. There are a number of studies to substantiate the effect of stress in diabetes. So Prameha is Anushangina, Medovaha Srodhomulam, Kadi Vrika, etc. So here I'm going to discuss about the problems or neurological problems that are caused by prameha. So here you know the prameha upadravas and all, you have all studied it. And upadravas due to vada, that is udavarta kamba shugula shosham kasam shwasam. These are all the upadravas caused by vada dosha. And diabetic neuropathy is the most what you say the complication of diabetes. That can cause a nerve damage. Long-standing high blood sugars causes nerve damage, and it is one of the most complications of diabetes. And these are of different types. That is peripheral neuropathy affecting the hands and feet, tingling, burning sensation, you know, and autonomic neuropathy that is affecting the digestion, heart, bladder, sweating, etc. Then proximal neuropathy, which is affecting the hip pain, hip and having weakness, and focal neuropathy, that is a sudden weakness of one nerve, like eye or face or leg. One nerve will be affected. So that is focal neuropathy. So these are all examples of peripheral neuropathy. Either two palms and hands will get numb and all. So this is all about different types of neuropathy. Then causes. Diabetes is one cause, vitamin deficiency, alcohol abuse, infections, autoimmune diseases, toxins, trauma inherited. And this is the line of management, Vata Pitta Hara, Agni Samrakshana, Rasayana treatments. So medicines like Shundi Bela Doyam Kashayam, you know, Suptivada Haram Param, and Ashwagandhadi, etc. will have good results in this thing. And Abhyangam, Visheshal Padabhyangam is very effective. And also Shashtiya Pinda Sweda. The most good choice of drug is Shilajadu in such conditions. And Shilajadu, you know, the dose you can give 2 to 8 rati rasayana. It is rasayana, and also it is a mutra drug. Visheshana yoga vahi rasayanam as per Rasatarangini. Jaravyadi Prashamanam, Dehadatyakaram Para, you know. And another thing is Sornamakshi Vasmam. Sornamakshi Vasmam, you can manage diabetes as well as all these conditions. I already told you about tissue inflammation and all. So it can be effectively managed by Sornamakshi Vasma. It is effective in Shaya, Arshas, or Vasti Vedana, Pandu, Shvedu, Jirna Jora, Avasma, Radiji, Anidra, and renal colic, everything is very very popular drug. I don't say the word popular because people don't know the good results of Sornamakshika. Even some people are also not willing to write Sornamakshika. It is very cheap. You can for 10 days dose you need only 20 or 18 rupees for buying the Sornamakshika Vasma. Okay. Then these are all herbal combinations. Nishamalaki Churma, you know. So this Chandraprabha, along with the Nishamalaka Churna, has got good results in managing such complications. So we used to give this Nishamalaka Churna by performing bhavana in various drugs. That is like if you are having severe diabetes, we use Nishamalaka Churna bhavana in Guluchari Kashaya. If you have some eyesight related problems, the same thing will be administered by using bhavana in Triphala Kashaya. Like that, we can alter different, as per the disease, you can give the Nishamalaka Churna Bhavida in different forms. Okay. So this is another special combination having Rasa and Gandhaga along with the Chandraprabha Gulika, along with the Madhu Sarpi in a Vardhamana Pramana. That is having good result, especially. So you all know the indications of Chandraprabha Gulika. So in Mutra Krichra, we are giving it with Shadavari Kashaya, Shadavari Chinnaruhadi Kashaya with tender coconut and all. In Prameha with Nishagadagadi Kashaya, I already mentioned you. Then in BPH with Vastayamaya Grida. Then in Netra Yoga with the Punarnavadi Kashayam. In glaucoma with the Triphala Kashayam. In retinal edema with the Triphala Gridam. In fatty liver with the Vasha Guluchadi Kashayam. And in pancreatitis with the Triandiadi Kashayam. These are the common prescribed Chandraprabha Gulika in administered with different. This is also another Anubhuta Yoga, Amrita Sattva, Amalagi, Nisha Churnam, and Eganayaka Churnam. This is called, we call it as Amrita Mehari Churnam, but it is an Anubhuta Yoga. Amrita Sattva is used. Used to give it with the Rasa Sindhura in acute Prameha patients. Okay, this is another yoga which is mentioned in Dhatri Haridra Swarasam, which is in Vaidya Manorama. Dhatri Haridra Swarasam, Shaudrena Maduram Pibet, Kalkam, Haridra Sambhuda, Amalagya, Esainava. And coming to Agni Tundivadi. Agni Tundivadi, I think that has got a very significant results in managing neurological conditions. This is mentioned in Vaishya Ratnavali Agni Vandya Adhikara and all. And the ingredients are Shuddha Bharata, Gandhaga, Valsanaba, and so many other drugs, and the equal part of Vishamushti. This indicated in Agni Mandya, Ajirna, Vishakna, and Shulahara property. It's given in Marija Prama. And Nimbus Varasa is the Anupana, or you can give it with the water or buttermilk. This is having Vishamushti or Kanjiram in Malayalam, and it acts as an inhibitor. Acetylcholine inhibitor, that will relieve pain and all. So you can give it as a very good painkiller, which is found very effective in the management of literacy or carpal tunnel syndrome or tennis elbow. Any sort of pain, you can give this Agnitundi Vati. Okay. I have a number of cases with got relief with the Agnitundi Vati. I used to give 2 tablets twice daily for 1 month. That will give good results. Okay. Then Arogyavardhini Vadi, you all know, it is very effective in managing Yagrit Vikaras and all. Rajagola Palomama, we can give it in a larger dose also with a suitable Anupana and all. I used to give Arogyavardhini Vadi along with the Katuki Churna, with the Sharkara. That is found very effective in the management of many diseases, especially in Kamala and all, and also some other fibrosis of liver. That grade 5 has turned to grade 1 after 41 days of administration of Arogyavardhini Vati. Okay, along with the Katuki Churna. This is the result, and you can see fatty hepatomegaly, right renal calculus, and anterior wall fibroid in uterus. After 2 months, this is on the June, and this is on 9, 3 months. So this was, there are no other, only some fatty changes in the liver. That was the only finding. The uterus was found normal, and every other, there was no signs of a calculus or a fibroid, and the hepatomegaly was relieved, and just a fatty changes in the liver. Okay, there was no enlargement. So you can, within 3 months of period, you can get good results by effective use of this Rasaushadhi. Okay. Another one is Navayasa Churnam, which is administered in, which is found, the reference is found in Attangadayam Pandu Chikilsa. You know that Loha Churnam is having with other drugs. Bhavana is done in Gomutra. And this is also effective in management of Prameha and also the complications like diabetes, retinopathy, and all. Okay. And we used to give Nisha Ushiradi Keratailam, which is mentioned in Sahasrayogam, to manage such conditions. We will give it as a Talam or as a Murda Thailam. It is that mentioned, the reference is in Pitaka, Prameha, Pitaka, Chikilsa, Daham, etc. But it is found very effective. The Kalkam given is Eladigana. So it is effective in management of Pitaka and all. But it is very effective in managing neuropathy. And Gomutra Arka, there is another study which has been conducted, and we found that it helps in reducing the complications due to diabetes. So this is a home remedy which we are giving Mudgayusham along with honey or durva, karaskara and butter externally. Mudgayusham plus honey or durva. With Mudgayusham with the honey or durva butter externally. That is the line of management for treating the burning sensation. And okay. And another one is Vasanta Kusmagarasa. The ingredients are very good ingredients like Sornam, Gajadam, Vangam, Agam, Kandam, Apragam, Pravalabasmam, etc. And many Bhavana Drivyas are also there. So we are giving for all types of prameha and its complications. Then Arugalam, Amrudam, Kulpin, Turva Sakraladayim Pirinadil, Vegum and Makadalik, you all know all types of very effective prameham and the kamala we can manage with the Arugaladi care. In case of severe heat, sometimes people complain that, okay, sir, I am not able to sleep because of heat. In such conditions, you can use Tungadrumadi Keram or Lakshadi Yamagam or even Vishoshiradi Keram. And coming next is the Rasasindura. Rasasindura, you all know, used in all types of diseases, and don't worry about using Rasasindura. And for beginners, I used to tell them that, okay, if you are prescribing Lasasapta Kashayam, you just add a pinch of Rasasindura along with the Shundi Jorna. So Shundi Jorna you will add, okay, then you can add Rasasindura also. So you will find the difference in managing the condition. So a lot of studies are there. These are very safe and even 10,000 times safer than chlorides of mercury. And I found that my studies in PhD, and I found that it is very effective because even it is much better than Diguna Belicharika Rasasindura. And so many other findings were also found because the telomeres of that cells were realigned, and also that regeneration that helped to regeneration of cells and all. And the contrasting factor is that Kajali, the base ingredient of Rasasindura, that is showing high degree of cytotoxicity. But coming to Rasasindura, especially the Diguna or Triguna, that is much safer and that is not at all showing any toxicity. This was the finding of my thesis. So I think you can go for more researches on Rasasinduram. So many studies are also there. I will conclude this session with one or two examples. That is cervical dystonia. I think you may have heard about this condition. It's not a very common problem, but many people are suffering from this thing. This involuntary neck muscle contractions, like that people will be sitting like this and they will be suddenly tilting their head. It is involuntary, jerky movements, and the people will not be able to, drive, or even they are not able to read books and all. So some patients came to me and told that, sir, I am not able to drive. I was a very good driver, but right now I'm not able to do this thing. He took some Ayurvedic treatment, but no relief. Initially, I also gave some Murda Tarpanam, Talam and all. There was no relief in that condition. So I gave him this Brihatvada Chindamani Rasam. After that, this jerking was reduced. The frequency of jerking was reduced. That frequency was considerably reduced. And after 1 month of Brihatvada Chindamani, this patient was completely get rid of this condition. Okay. So this is a stiffness of neck, pain may be severe, involuntary reaction will be there, headaches and raised shoulder symptoms. These are all the secondary symptoms. So Manyastambam and Akshayabhagam can be correlated with this condition. Manyastamba, Kartabhyam, Tikshanam, Nasyam, Virajanam, etc. So here we can, in IP conditions and all, we can use this Nasya, Kapavarana Chikitsa, Snehana, Shodhana, and Murdadailam and all. Internally, Vaduttam Sarasam you can give Vadagajangu Sarasam, Dashamula Quatham, Panchatiktaka Gugulu, Prasarani Adik Shira Quatham, Annavedi Sinduram along with the Rasa Sinduram. Annavedi Sinduram along with the Rasa Sinduram. For Avarana Haratham, it is a very good drug for breaking the Avarana and all sorts of Avarana we can break with this Annavedi Sinduram and the Rasa Sinduram in combination. Then giving any suitable Gritam like Mahakalyanagam or Brahmi Gritam was given. Prakatwada Chindamani Rasam was given. The same thing. Now, Vata-Gajangushasam, it is also effective in managing torticollis, muscle stiffness, coccyx pain, brachialgia. So it is also having that anti-inflammatory and analgesic property. So these also can be given along with Pragadvada Chintamani. So coming to the conclusion, there is no activity in Sharira without Vata. So Vata, Vata is the seat, lord of all doshas, and it is the key of keystone of Chikitsa, what you say. So you have to control Vata and proper, not only the Chikitsa, proper diet, exercise, and everything that is helping the Vata phenomena has a key role in your treatment. And also by administering Rasaushadhi with the Kashtoshadhi, proper implementation or proper integration of Rasaushadhi in your practice will give you lot of success, and wish you all success once again, and thank you so much.
Sir, for the informative and insightful session, the session is now open for questions.
കേൾക്കാം, കുറച്ച് ഫീബിൾ ആണെന്നാലും പറയും. എത്ര മാസം വരെ രസസിന്ദൂരം രസസിന്ദൂരം നമുക്ക് ഞാന് frankly speaking, I have given it for 1 year continuously, and I have all the reports with me. But I used to give a small break in between because after 3 months I used to break for 2 weeks or 1 month. Then again I will start these things. We have got good results for that also. So continuously giving, and I have taken the pre-value of kidney function and all, and also after 1 month, and even the patient is still there after 5 years and all, he has no problem with the kidney or liver. So there is no problem that we can give this thing. I think most economic formulation is Rasasinduram and Aparakabasmum among all these Rasaushadhis.
Thank you, sir.
മറ്റേ ആവരണമാണോ സർ? ആവരണത്തില് ഹണിയാണ്. ആവരണം ഞാൻ സാധാരണഗതിയിൽ 1 month ഒക്കെ കൊടുക്കേണ്ടി വരാറുള്ളൂ. അതിനുള്ളിൽ തന്നെ നമുക്ക് പക്ഷാഘാതമൊക്കെ ആണെങ്കിലും വി വിൽ ഗെറ്റ് റിസൾട്ട്സ്. അപ്പം സാധാരണഗതിയിൽ ഹണിയാണ് കൊടുക്കുന്നത്. പിന്നെ ഓരോ സ്പെസിഫിക് ആയിട്ടുള്ള കണ്ടീഷൻ അനുസരിച്ച് നമുക്ക് വേണമെങ്കിൽ കഷായങ്ങളോ വല്ലതും ആഡ് ചെയ്യാം. അതർവൈസ് ഹണി വിൽ ഡു.
പിന്നെ ക്ഷീരധാര എന്ന് പറഞ്ഞില്ലേ സർ? അത് എങ്ങനെയാ സാർ അത് കൊടുക്കുന്നത്?
കാരസ്കര ക്ഷീരധാര സാധാരണഗതിയിൽ എക്സ്റ്റേണൽ ആപ്ലിക്കേഷൻ ആയതുകൊണ്ട് ശോധന ചെയ്യാറില്ല. അത് കാരസ്കരം, നമ്മൾ സാധാരണ കാരസ്കരം ഇട്ട് കഷായം വെക്കുന്നു. നമ്മളിപ്പോ സാധാരണഗതിയിൽ ഇപ്പൊ ഒരു ധാരയ്ക്ക് ആവശ്യമായ കഷായം 5 ലിറ്ററോ എത്രയാണെന്ന് വെച്ചാൽ അത് വെക്കുന്നു. അതില് നമുക്ക് സൂട്ടബിൾ ആയിട്ടുള്ള അളവിൽ കാരസ്കരം, മേ ബി 100 ഗ്രാംസ് കാരസ്കരം ഫോർ 5 ലിറ്റേഴ്സ് ഓഫ് കഷായം. അപ്പം അത് വെച്ചിട്ട് നമ്മൾ തിളപ്പിച്ചതിന് ശേഷം അതിനകത്തേക്ക് 1 ലിറ്റർ മിൽക്ക് ആഡ് ചെയ്ത് വീണ്ടും ബോയിൽ ചെയ്യുകയാണ് ചെയ്യുന്നത്. അപ്പം എന്നിട്ട് അത് ക്ഷീരധാരയായിട്ട് ഉപയോഗിക്കുകയാണ് പതിവ്. അപ്പൊ ഈ ഡയബറ്റീസ് റെറ്റിനോപ്പതി ഉള്ള ആളുകൾക്ക് നമ്മൾ സാധാരണ ഈ ഒരു ധാര എക്സ്റ്റേണലിയും, ഇപ്പൊ ധാരയ്ക്ക് മുമ്പ് തൈലം തേക്കണമെങ്കിൽ തേക്കാം, നിർബന്ധമൊന്നുമില്ല, അത് ഓരോ കണ്ടീഷൻ അനുസരിച്ച്. ഇപ്പം സഹചരാതി തൈലം എക്സ്റ്റേണൽ ആപ്ലിക്കേഷൻ, അതിനുശേഷം ഈ ധാര ചെയ്യുന്നു, ഇന്റേണൽ ആയിട്ട് അഗ്നിതുണ്ടി വഴി കൊടുക്കുന്നു. അപ്പൊ ഇത് ചെയ്യുമ്പോൾ ഈ ന്യൂറോപ്പതി പേഷ്യൻസിന് വളരെയധികം ആശ്വാസം ലഭിക്കുന്നതായിട്ട് കാണും. അല്ല സർ, ഞാൻ ശിരോധാരയല്ല, ഞാൻ പ്രാദേശിക ധാരയാ പറഞ്ഞു. ശിരോധാര ചെയ്യുന്നതിന് കുഴപ്പമില്ല, പക്ഷെ ശിരോധാര ചെയ്യുമ്പോൾ ചില പേഷ്യൻസിന് അത് ഒത്തിരി ഒരു ഇതുപോലെയൊക്കെ തോന്നും, അത്രേ ഉള്ളൂ. വേറെ കുഴപ്പമൊന്നും കണ്ടിട്ടില്ല. പക്ഷെ യൂഷ്വലി ഇപ്പൊ നമ്മള് ഇവരുടെ ന്യൂറോപ്പതി ഹാൻഡ് ആണോ ഫീറ്റ് ആണോ മറ്റേതെങ്കിലും പാർട്ടാണോ എന്നുള്ളത് നോക്കിയിട്ട് അവിടെ ലോക്കലായിട്ട് കൊടുക്കുക ചെയ്യാം. അതെ. എന്താ സർ? ഹലോ, അതെ അതെ അതെ.
I hope there are no more queries. Thank you, sir, for patiently addressing all our queries and sharing your valuable knowledge. We sincerely appreciate your time and guidance and look forward to much more session in the future. Thank you so much.
താങ്ക് യു. എന്തായാലും വളരെ സന്തോഷം. 1 hour തീർക്കാൻ പറ്റുന്ന പോലെ ശ്രമിച്ചു. എനിക്കറിയായിരുന്നു, കാരണം വെച്ച് കഴിഞ്ഞാൽ കുറച്ച് അധികം കാര്യങ്ങളുണ്ട്, കുറച്ച് സ്ലൈഡ്സ് സ്കിപ്പ് ചെയ്യേണ്ടി വന്നു, ചില സ്ഥലത്ത് കൂടുതൽ എക്സ്പ്ലനേഷൻസ് വേണ്ട ആ സ്ഥലങ്ങളുണ്ട്. ബട്ട് സ്റ്റിൽ ഞാൻ പറയുന്നത് എന്ന് വെച്ച് കഴിഞ്ഞാല് നമ്മള് ഇത് പ്രാക്ടീസ് ചെയ്യുക. രസശാസ്ത്ര എന്ന് പറയുന്ന ബ്രാഞ്ച് നമ്മള് ഇത് പ്രാക്ടീസ് ചെയ്താൽ തന്നെ ഇത് വളരെ ഉള്ളൂ. അപ്പം നിർബന്ധമായിട്ടും എല്ലാവരും, കാരണം വെച്ച് കഴിഞ്ഞാൽ നമുക്ക് വളരെ നിഷ്പ്രയാസം ചെയ്യാവുന്ന കാര്യങ്ങളാണ്. ഞാൻ പറഞ്ഞല്ലോ, കാരണം വെച്ച് കഴിഞ്ഞാല് ഇപ്പം അതിൽ ഏറ്റവും ഇതായിട്ടുള്ള ഇപ്പൊ റീസെന്റ് ഒരു അപ്പൻഡിസൈറ്റിസ് കേസ് വന്നു. ഞാനത് പറഞ്ഞിട്ടുണ്ടെന്ന് തോന്നുന്നു. അപ്പൻഡിസൈറ്റിസ്, ഈ രസസിന്ദൂരത്തിന്റെ കാര്യം പറഞ്ഞപ്പോൾ ഞാനൊന്ന് പറഞ്ഞതുള്ളൂ. കാരണം എന്ന് വെച്ച് കഴിഞ്ഞാല് രസസിന്ദൂരം നമ്മള് എക്സ്റ്റേണൽ വൂണ്ട് ധാരാളം കേസുകൾ വരാറുണ്ട്. സിരാഗ്രന്ഥി വന്നിട്ട് വീനസ് അൾസേഴ്സ്, ഡയബറ്റിക് അൾസേഴ്സ്, അങ്ങനെയുള്ള കണ്ടീഷൻസ്. അപ്പം കുറച്ചു നാൾ മുമ്പ് ഒരു അപ്പൻഡിസൈറ്റിസ്, ഒരു 7-year-old ബോയ് ആണ്. ഹി വാസ് ഡയഗ്നോസ്ഡ് ആസ് അപ്പൻഡിസൈറ്റിസ് 7.5 mm ഉണ്ടായിരുന്നു. ആൻഡ് അപ്പൊ ഞാന് സത്യം പറഞ്ഞ ഇദ്ദേഹത്തെ തിരിച്ച് പറഞ്ഞു വിടുക ചെയ്തത്. അപ്പം അത് പിന്നെ അവര് സമ്മതിക്കുന്നില്ല. അതായത് സർജറി ചെയ്യാൻ അവർ വില്ലിങ് അല്ല, പ്രത്യേകിച്ച് ആ പയ്യൻ വില്ലിങ് അല്ല. ദാറ്റ് ബോയ് വാസ് നോട്ട് വില്ലിങ്. സോ ദ പാരന്റ്സ് വർ റിലയിങ് ഓൺ ആയുർവേദ. അപ്പൊ ഞാൻ പറഞ്ഞ ഒരു കാര്യം ചെയ്യാം, വി വിൽ ഹാവ് എ സെപ്പറേറ്റ് ഡയറ്റ്. നിങ്ങൾ എന്തായാലും സർജറി ചെയ്ത 2 ദിവസം നിൽ ഓറൽ അല്ലെങ്കിൽ എന്തെങ്കിലും കഞ്ഞിവെള്ളം ഒക്കെ ആയിരിക്കും തരുന്നത്. ഐ ഓൾസോ വിൽ ഗിവ് യു കഞ്ഞിവെള്ളം. ദെൻ യു ഹാവ് ടു സ്റ്റാർട്ട് ദ ട്രീറ്റ്മെന്റ് എന്ന് പറഞ്ഞു. രസസിന്ദൂരം പ്രവാളഭസ്മമാണ് കൊടുത്തത്. പിന്നെ ദശമൂല ഹരിതകി ആൻഡ് വരണാദി കഷായം, വരണാദി കപമേധം മന്ദാഗ്നി നീയച്ചതി, ആഠ്യവാദം ശിരശൂലം ഗുൽമഞ്ച അന്തസവിത്രതി, ഈ ഒരു ഇതേ എടുത്തുള്ളൂ. അപ്പൊ ഗുൽമം, വാദ, പിത്ത കപ ഗുൽമവും ആൻഡ് അന്തവിദ്രതി എന്നുള്ള രീതിയിലാണ് അത് ചികിത്സ ചെയ്തത്. എനിവേ ഒരു 2 ദിവസം കഴിഞ്ഞപ്പോൾ പനി കുറഞ്ഞു. ദെൻ ആഫ്റ്റർ 1 month, അതുവരെ നമ്മളൊരു പേയാതിക്രമം അവർക്ക് കൊടുത്തു. പേയാതിക്രമം പോലെ തന്നെ നമ്മൾ സാധാരണ ഇതിനകത്ത് കൊടുക്കുന്ന പോലെ ആദ്യത്തെ 3 ദിവസം കഞ്ഞി, പിന്നെ വറ്റോട് കൂടിയ കഞ്ഞി, അങ്ങനെ ഒരു 2 ആഴ്ച കൊണ്ടാണ് ആൾ ചോറുണ്ട രീതിയിലെത്തിയത്. After 1 month, we again took him for UST, and it was found that after 1 month of treatment, this appendix was in normal size. So again, I referred him to the surgeon, and surgeon told that okay, there is no need of surgery right now. And this patient is still here, and he's right now 14 years old, and it has not recurred. So after this success, so many, I think 7 or 8 cases of appendicitis came to me. And almost the same management was performed in all the patients. So I think Rasasindura has to be explored much more. So that's why I told you all the aspirants of our Rasayastra to come forward with new possibilities and practice well. Thank you once again for the opportunity. I'm not wasting your time. Thank you, Ramesh sir, and all teachers and faculty of Amrita Institute and also PG scholars for this wonderful opportunity.
Thank you, sir.
Thank you.
you.
Most.